everyone. I was thinking about you this weekend while I'm in the lab with the second year hybrid students. And one of the things that I think comes up with pathophysiology, whether as to whether or not it makes sense for you, is whether or not you have a hook to hang it on, right? Is there something that makes you remember that thing or associate it with a patient or what a patient is going to look like? That's one of the reasons why I like case studies, because it gives you an idea of sort of what a patient is going to look like. And another reason why I like the assignments where you come up with a case study and the other person has to figure out what the disease is. And the idea is to get you to sort of picture what a patient is going to look like. So in thinking about the diabetic ketoacidosis versus insulin shock, which are kind of two opposites that are both life-threatening situations, they generally happen with people with type 1 diabetes. It's not common in people with type 2 diabetes. But how do you tell the difference? How do you tell them apart? And basically, if you had an unconscious patient and you knew that they had diabetes because they had a medical alert bracelet that said they had diabetes, how do you know? Did they collapse because of diabetic ketoacidosis, or did they collapse because of insulin shock? And really, two things you can look at, or one major thing you can look at is their skin. If they collapse from diabetic ketoacidosis, their skin is probably warm, red, and flushed. Warm and flushed and dry. And the fruity or acetone breath odor, that is very indicative of diabetic ketoacidosis. So you don't need to measure their blood sugar or do anything to figure out that that could be the problem. If somebody is down from insulin shock, it's probably because they are going to present with pale, moist skin instead of warm, dry, flushed skin. So just the skin color can clue you in as to what's going on with that person. Either one of them, we're calling 911, or if you're in the hospital, you're calling the nurse, because that is a medical emergency and it needs to be dealt with right away. The person with insulin shock, their blood glucose level is really low, their insulin level is higher. They are going to be treated, an unconscious person will be treated with intravenous glucose. If someone is conscious and they're in insulin shock, they're going to be treated with oral glucose. So in the clinic where I work, we have a diabetic emergency kit, and one of the things that these little packs, like they're the little things like bicycle racers use, sort of, but they're specific for treating diabetic emergencies. And it's a concentrated form of glucose. Some people carry little honey packets or something like that, and that's another concentrated form of glucose that you can put right into your mouth. When you have an unconscious patient, you never want to apply anything through their mouth because they could choke on it and aspirate. So if you have someone who has diabetic ketoacidosis, then they need insulin. And so some diabetic emergency kits have insulin, and most of the time in hospitals, and some do not. And we're not usually administering people's insulin, but if they're conscious, they can administer the insulin themselves. But that skin color difference, that is a major difference, and that is a really good way to tell the difference between the two. I just wanted to share with you an experience that I had with a patient in the past, and it was when I worked in the emergency room, and it was night shift. So we had EMTs in the emergency room. The hospital I worked in was a small sort of rural area, and we didn't have techs or anything like that. We had nurses, paramedics, EMTs, and physicians working in the emergency room at night, particularly. So just and this was in Colorado, and at that time, the highway patrol would, if they pulled someone over for a suspected DUI, they would have blood drawn for what they called at the time a legal blood alcohol level. And so in our little rural area where we were, they would bring people to the hospital emergency room to get their blood drawn for that legal blood alcohol. So a highway patrolman came in the middle of the night. He had someone with him who had driven their car off the road and appeared very impaired. and the highway patrolman thought the person was intoxicated, brought them to it was basically on their way to jail, um, and brought them to the hospital to get that legal blood alcohol drawn. And what would happen is the lab tech would draw the legal blood alcohol. They would seal it in this specific package and send it to the state lab so it could be used as forensic evidence in court. And so the person came in, and so we had an ER doc, an RN, a paramedic, and an EMT, and the highway patrolman. All of us looked at this person and we said, "This person's been drinking." That was that was the thing that is how they appeared, like a staggering gait, very unsteady, low level of consciousness, kind of not aware of their surroundings and everything, and helping them up to the gurneys that we had as beds in the emergency room. They were very stumbly, very, so all of us, all the medical professionals, all the legal professionals, all looked at this person and said, "This person's been drinking. This person's impaired." That's how they appeared. Um, and so while the lab tech was drawing the medical blood alcohol, the ER doc, just to cover bases, said, let's do some other lab tests as well. So he drew a medical blood alcohol and a chemistry panel and a complete blood count, just to see if there was anything else going on. So the medical blood alcohol came back first. And what do you think the result was? It was 0. The medical blood alcohol was 0. And so the doctor, he was like kind of a fiery guy. He called up the lab yelling at them and he says, run this test again. He goes, this guy's obviously been drinking. Run this test again. And the lab tech's like, okay. So in the meantime, the chemistry came back and the person's blood sugar was 68, which is significantly below normal in insulin shock range. And the doctor looked at the lab results and said, "We blew it. We absolutely blew it." They gave the person IV glucose, and he snapped right back into consciousness and alertness. So he wasn't unconscious, but he was very impaired. As soon as they gave him the IV glucose, he was normal again. And that stuck with me. That has stuck with me for 40 years because it was so dramatic. And because all of us, every single person in the room, from the ER doc to everybody, thought that this person was drunk. And so honestly, if the doctor hadn't drawn those chemistries, hadn't run the chemistry panel and seen the blood glucose that low and treated them, they probably would have died overnight in jail. This poor innocent person who all they had was an insulin problem. And then once he was conscious again, he was telling us what happened, and he had to skip a meal. So he had taken his insulin. He was at a board meeting for a community board that he was on, and it went long, and he had to skip, and he skipped dinner. And so his insulin was high, his glucose was low. He was driving home, and he drove off the road because it got to that point where his brain was just not getting enough glucose. So, luckily it happened the way it did and everything was okay for him. The other thing that the ER doc did after the person was stabilized is he gave him a medical alert bracelet that said he's diabetic, and he said, "You have to wear this all the time," because if the highway patrol had pulled him over and he was altered consciousness and they saw that medical alert bracelet, they would have known right away what was going on with him, and he would have been at much less risk. So sometimes having a patient story like that really brings it into focus. So the symptoms that we saw with him was the disorientation, staggering gait. He had pale, moist skin. That didn't clue us in though, but now it will. Every single one of us that was in that room then knew that's what we're looking for when we see someone like that. So never assume that someone is drunk just because they look like they are. And look for a medical alert bracelet or a medical alert tag, because they might be in insulin shock. So that's my story of the day, to give you a patient to relate this to.